Hi, can you hear me? Okay. I'm sure you are hungry, so I'll try to make it very quick. Now, you might have heard about the term dental implant, but for which we didn't hear about that, I want to give you a very simple idea, or what you call an overview of what we call oral implantology. Yeah, here we go. So very briefly, an implant is a kind of material, a fixture, which is implanted inside the bones of the jaw, hence the name implant. And it is actually the infrastructure upon which crown and bridge can be built up. Why implants are important very quickly? Because, of course, they preserve bone, also the facial form. They can restore normal function, improve aesthetics, and increase patients' self-confidence. Now, the story begins thousands of years ago, BC, when man was really obsessed by the idea of how to replace missing teeth. They have tried everything: gold, metal, ivory, stones, even shellfish or animal teeth. And that was, those specimens you can see here are really thousands of years old. I have to go quickly, and then in modern times also, the early researchers and scientists and also the early dentists tried to do everything to replace missing teeth. And there were so many shapes of early implants which actually all failed. Now, after coming to this man here, Professor Brånemark of Sweden, he is really the father of modern dental implantology. Because he was, by the way, a physician and not a dentist, and he made for so many years research upon which is the ideal metal to be inserted in the skeleton of the human being. And he came up, after more than 15 years of studies, with titanium. So titanium is biocompatible, means biocompatible, is compatible with the human tissues and cells. And he started by commercially pure titanium, and then he added some kind of alloy to make it stronger. Other materials have been used, like ceramics and plastics and resins, but still titanium is the main metal used for implants. Now, Professor Brånemark made his studies as early as the 60s, and he presented his method in international conference, 1978, also a Toronto conference, 1982. At that time, all the dental profession started to know about the Brånemark system. Now, he coined his method by what we call osseointegration. He discovered during his research, by coincidence, there are some living bone come out on the surface of the implant and be actually fused with the implant. And he named this osseointegration. Now, this is a very famous electronic microscopic picture of living bone, as you can see, coming on and growing on the surface of an implant. When everybody knows about that, he started to marketing the system, and it was called the Brånemark system, and marketing by Nobel Pharma. Nobel Pharma is Swedish originally, but then the American bought it. And now we started at the early stage. I have to go quickly, really. This shows you what an implant is, replacing the root of a missing tooth. Now, when we started, it started in the late 80s, the propagation of modern dental implants by Professor Bronnemark, and I have the privilege to be in Ireland at that time during my trainings, and we started to make implants in operating theater under general anesthesia. Actually, all was new to us, and even we kept the patient 1 or 2 nights in intensive care unit. Imagine, now it's a very simple procedure. Now this showed the surgical technique which has to be to put an implant. It's a very simply a 3-unit case. The implant itself, an abutment, and a screw over it. Now we have to wait for a healing period after inserting the implant, and it started from 4 to 6 months approximately. After that healing period, what we call the second stage surgery, the gingiva is open again, the screws are removed, and the abutment are put. I won't go to tell any dental technicalities here. I just will give you a very simple idea about dental implants. Now there is another technique which is not surgically, so we can go directly through the mucosa up to the bone without making any surgical interference. So simply new teeth in 3 steps: an implant, an abutment, and an overcoming crown. Now this is a breakthrough actually in dental implants. So now you can replace your missing tooth without having to go to grind normal natural teeth. The applications can go up to either replacing 1 single tooth or even a 3-unit bridge, as you can see in the slides here. Also, we can make a complete reconstruction of the jaw, putting many implants and then the overstructures upon it. Also, they're called ball attachment over denture, that seniors who have dentures after missing all their teeth have very difficult time of eating. Actually, the dentures are not easy. They're moving all the time. So we can apply those kind of ball you can see here and then put the denture over the ball so make it less moving. So, well, we can talk a lot about many things, but what I'm trying to do is to give you a very simple idea about implants. The over-denture could be ball attachment or it could be a bar attachment. Okay, there have been a lot of designs with different shapes and sizes, really, since Professor Bronnemark introduced us in the late 90s up to now. Actually, hundreds and hundreds of implants, a plethora of implant designs have been in the market, really. And you can find from spiral to pointed to needle-like. And let me tell you, there have been now more than 150 implants, which we can say are registered and recognized around the world. But also there are dozens and hundreds of other non-registered subsystems exist around the world. Now we will, sometimes someone asks us all the time, which is the best implant in the world? It's not that easy, but we are relying on so many factors, like here the word sale share, the company age and reputation, of course, quality manufacturing, easy to use, rapid also integration, dealer, scientific research. And upon those factors, we can conclude, I can give you some names here of implant system around the world, starting from Nobel Biocare, which was originally Sweden, now it's American. Also Straumann system, very famous Swiss, but now also American. Actually, all top 10s are Americans. And then Splice Rona. I give you the 3 The up three here are the most famous and most expensive dental implants in the world. But you have 150 names to choose from. Who is allowed to do implants? Anyone above 18 years, all normal and healthy cases. Senior individuals, age 65 and above, provided they are healthy and in good medical condition. But also, some compromised cases, as heart conditions, hypertension, controlled diabetics, provided they are medically stable and under control. And I have done a lot during the past years of my implants, mainly on senior compromised cases. Now, who cannot do implants? What you call uncontrolled diabetics, osteoporosis, and vitamin D deficiency. And those three are the main three reasons for failure of implants. Also, poor oral hygiene, heavy smokers, and alcoholics are bad factors. There are some procedures to be done before starting an implant. The implantologist is evaluating the case, the oral tissue, the teeth, everything, the general medical condition, the available spaces of the implants, the bone condition, and study case models are done. We select the implant, we prepare the kits and our motor, and then we start to do our x-rays. There are a few x-rays like the normal dental x-ray and what you call the panoramic x-ray, which is two-dimensional. Also, we can use what we call CBCT, which is a 3 computerized guided kind of picture that we can exactly locate the bone and the space where we can put our implant. Also, some surgical templates are constructed beforehand. Now, you need a certain equipment to put an implant. You need a motor and you need a kit and a lot of accessories also. So those has to be prepared, sterilized, and ready. Now, some cases we need one that's the bone is not enough, in enough quality to receive an implant. In this case, we have to put what we call a bone graft. Like in this slide, you can see the bone graft comes in many shades, in many shapes, like a bowl, plate, a syringe, whatever we have. So many techniques. We won't talk about so many details here. Also, tissue grafting, which we can put over the bone graft to protect the bone graft during the healing period. And in some cases, we have some difficulty, like we have very, very small, not enough bone support for implant in the upper jaw because of what we call the paranasal sinuses. In that case, the sinus has to be lifted up, and bone has to be done grafted under the sinus. It's a procedure which we can call a sinus lift. I'll show you some clinical cases very quickly. Like this case here, it's one of a young individual which has missed the upper central incisor, and what I can see is the end result after the implant, the abutment, the healing period, and the crown. It looks so natural. Even this. And here also more than one implant. Here 2 implants. And this after a post-traumatic replacement of the 4 central and lateral incisors in the upper jaw. No need to go for details, but mainly you can replace one tooth, multiple teeth, or even an entire jaw, like this one. Now you can see how really implant placement, crown and bridge, and smile makeover can change the life of individuals. Look at this lady here, before and after. It's amazing. Look at this man here, before and after. By the way, the slides are really not very clear. I don't know why. But implants change individuals. There are special forms of implants very quickly in doses going inside the bone or over the bone, which we call subperiosteal. Like this, can be screw type, cylinder type, or a blade type. There's so many shapes and types of implants, really. Now, this is good about an implant, a blade one. This is subperiosteal, which is not going inside the bone when the bone are not of good quality. It comes as a skeleton over the bone, what they call a subperiosteal implant. There's so many technicalities, no need for that. This is a stable bone implant, very complicated one. Don't worry about that. When people have actually a very small bone in the mandible, there is a technique done to insert the implant extra-orally from under the chin up to here. It's very complicated and really seldom used. Now, the implants, Professor Brammark was not a dentist. He was a physician, a researcher, and actually he tested as many metals as he can to see which metal can go biologically compatible with the human body. And his application was on the entire skeleton. But he found actually that in the jaws and the head and neck are the best places to get good results, really. Let me show you one or two slides. Like this lady after a cancer removal, we have this eye using osseointegrated implant, or even a nose after cancer. And I went very, very quickly. Actually, I can spend an hour talking about implants, but I think that you are hungry, all of you. So before I give a little quiz, I give you some celebrities that you must know that the smile makeover have changed them, actually. So tell me, do you know this chap? Tom Cruise, is it? Do you know this one? Morgan Freeman, yes. Nicolas Cage. Ben Affleck, yes, good girl. Do you know Cristiano Ronaldo? When he was young and started to be famous and rich, he changed his smile over. And Rooney, George Clooney. You know that? Demi Moore, exactly. Look, before and after. Julia Roberts, this is her smile makeover after, okay? Do you know the boxer? Mike Tyson, exactly. After so many broken teeth. This is another Ronaldo, but the Brazilian one. Another football legend. Celine Dion. You know that one? Nicole Kidman? Well, let me tell you, those are not my patients, those are celebrities. Otherwise, I would have been a very rich man, which I'm not. Right, and now let you tell me, my main story today is that implants can change the life of people. They can make you show a smile or enjoy a meal. And this is my message today.